Hi, parents. Today, I would like to discuss a topic called autism and pain. Okay, have you ever wondered, or have you ever come across whenever your child, the reason why your child actually having this self-injury behavior, screaming, shouting, aggression, suddenly meltdown, sometimes covering the ears, pressing the body part, sleep disturbance, withdrawal, avoidance behavior, and worse, sometimes school refusal or regression in skills. Okay, so the reason why is that so is most likely your child may suffer from pain. Yes, autism and pain. That's a topic for today's discussion. Okay, so many individuals with autism experience pain differently. Pain usually being under-recognized, misinterpreted, or expressed through behavior rather than words, or especially those non-verbal autistic. They are unable to express the pain. Okay. Back in my parents, the pain is real. Okay. So there's two types of pain: physical pain and psychological pain. Okay. So physical pain is usually being overlooked, okay, by a lot of professional, even parents, therapy, or doctor like us. Okay, so what are the type of physical pain which can cause your child to have different type of behavior problem? First, gastrointestinal pain. That is, if he has constipation, gastric reflux, bloating, or sometimes food indigestion or food intolerance that could cause trigger pain in the stomach. Okay. Second thing is very common, headache. Okay, most of the autistic child, they have headache because of various issue, mainly anxiety or stress. Okay, migraine, muscle pain. Why muscle pain? First, most of the child, they have low muscle tone, they have these joint problems or poor posturing, which can cause muscle pain, right? Then next, moving on is will be ear pain, nose pain because of sinus or sinusitis. Ear pain is because of infections. Okay, infections, inflammations, impacted wax. Okay. Then moving towards oral pain. Oral pain usually due to ulcer, throat, and toothache. Okay, or like caries or gum inflammations. All right. And lastly, sensory related pain. Again, as you know, most of the autistic child, they have actually sensitivity to, there's a lot of, they have this hypersensitivity towards light, sound, touch, which can cause pain like distress. And the pain is real. Parents, all right. So for physical type of pain, how are we going to approach? How are we going to manage? First, yes, always seek professional help. You need a throughout medical assessment. You need a, GI evaluations. All right, example, we would like to know how bad is the constipation, how bad is the diarrhea, how bad is the indigestions, how bad is the reflux. Okay, so then we have to do the ENT review, dental review. Okay, so this is under medical review. So we have to rule out all the possible causes, right? Then next, nutrient deficiency. Okay, most of the autistic children, they have nutrient deficiency of iron, zinc, magnesium, vitamin D, and etc., which can cause sensory issue. All right. So by correcting the nutrient deficiency, you can see there's an improvement in terms of their behavior. Okay, then next we have the inflammation and allergic assessment. So in inflammation allergic assessment, usually we assess on any like food allergy or food intolerance, skin allergy, dust allergy, and symptoms that are related to allergy, like running nose, nose block, redness over the cheek area, redness over the skin area. Then after that, there's a dark circle below the eyes. So this actually indicates your child may have some allergy issue. All right. The other one is persistent coughing. Persistent coughing, often fall sick. That also indicate allergy. All right. So then for the pain management, how are we going to treat the pain? Right. As we say, physical pain. So treat the underlying medical cause. If let's say it's a ear pain, nose pain, oral pain, then treat the underlying causes by giving medications, combination of medication, supplements, and dietary interventions. All right. So don't hesitate. Don't ever hesitate to give medication like analgesic, which helps a lot to reduce the pain. Second thing you can give is gastric medications to reduce the gastric discomfort. And the other thing, you can give anti-allergic type of medication like your flu medicines to reduce the allergy. Okay. Bear in mind, parents, when you're able to reduce the pain, especially the physical pain, you can see immediate improvement in terms of their behavior. All right. So now move on the other type of pain. All right. So the other type of pain is very commonly being discussed. That is the psychological type of pain. Right. So psychological pain is a real pain. Again, it's not a behavior problem. All right. It's not a sensory problems. Right. So the common type of psychological type of pain is anxiety related pain. They may have experienced stomach pain, chest tightness, sometimes they have breathing difficulty, their hand tremors, they have giddiness. So then the other thing is emotional pain from social rejection, bullying in school, being bullied in school, communication frustrations because of sometimes most of them they have been non-verbal or have limited speech. They have communications problem that also can cause a lot of emotional frustration and pain. All right. Then we have the other one, trauma-related pain. All right. Trauma-related pain, we mean trauma. Okay, what type of trauma? Okay. Oh, just for discussion. So, what type of trauma? So, sometimes they've been traumatized by their parents. They get beating by the parents. They get beating by the siblings. Get beating by the teacher. Beating by the friends. So, this is all example of trauma-related type of pain. Okay, then how are we going to manage psychological pain? So what are the treatment approach? First, again, very important, all right? You have to seek treatment from the professional, all right? But on the biological approach, so usually there's two. So one is nutritional support, as we mentioned just now. So we can give magnesium, vitamin B6, L-theanine, GABA to reduce the anxiety and help the child to improve the sensory issue. And also it helps for the child to be in a relaxed mode and more calming. All right. Then the other biological approach is the gut again, the gut brain support. So by giving probiotics, fish oil, glutamine, zinc again. So it helps to reduce the inflammations, help to reduce the gut inflammations, and it helps to reduce the pain as well. All right. So lastly, parents, okay, take this seriously. Autism and pain is a serious matter. So physical pain is a real, psychological pain is real. All right. So I hope it helps. I see you back in the next discussion. Bye.